Osteoarthritis is one of the most common joint disorders, affecting millions of people worldwide. It leads to pain, stiffness, and reduced mobility, often impacting daily life. Early and accurate diagnosis is crucial for managing symptoms and slowing disease progression. But how do doctors evaluate osteoarthritis? In this video, we'll explore the most commonly used tests and assessments that help healthcare professionals diagnose and monitor this condition. Let's start by understanding why proper evaluation is so important for osteoarthritis patients. Testing for osteoarthritis is essential because it helps distinguish this condition from other joint problems, such as rheumatoid arthritis or injuries. Accurate evaluation allows doctors to create personalized treatment plans, monitor disease progression, and adjust therapies as needed. Without proper testing, patients might not receive the most effective care. Now, let's look at the first step in the evaluation process, the clinical examination. Clinical examination is often the starting point for evaluating osteoarthritis. During this assessment, a doctor will ask about your symptoms such as pain, stiffness, and swelling. They'll also review your medical history and perform a physical exam, checking for tenderness, joint deformities, and range of motion. This hands-on approach helps the doctor identify which joints are affected and how severe the condition might be. Clinical examination is a fundamental step before moving on to more specialized tests. Detailed patient history is a key part of osteoarthritis evaluation. Doctors will ask about the onset and duration of symptoms, any previous injuries, family history of joint diseases, and lifestyle factors. Understanding these details helps differentiate osteoarthritis from other conditions and guides further testing. Patient history also reveals risk factors that might contribute to the development or worsening of osteoarthritis. Physical assessment involves observing how you move and examining your joints for swelling, tenderness, or deformities. The doctor may ask you to walk, bend, or perform certain movements to assess joint function. They'll also check for crepitus, which is a crackling sound or sensation in the joint, and measure the range of motion. These observations help determine the extent of joint damage and functional limitations. After the clinical assessment, imaging tests are often used to confirm the diagnosis and evaluate the severity of osteoarthritis. These tests provide a visual look at the bones and joints, helping doctors spot changes that aren't always obvious during a physical exam. The most common imaging tests include X-rays, MRI, and sometimes ultrasound. Let's take a closer look at each of these methods. X-rays are the most widely used imaging tests for osteoarthritis. They can reveal joint space narrowing, bone spurs, and changes in bone shape that are typical of osteoarthritis. X-rays are quick, non-invasive, and widely available, making them a standard tool for diagnosis. However, early osteoarthritis changes might not always show up on X-rays, so doctors may use additional tests if needed. Magnetic resonance imaging, or MRI, provides detailed images of both bone and soft tissues, including cartilage, ligaments, and muscles. MRI is especially useful for detecting early changes in cartilage and other structures that X-rays can't show. While MRIs are more expensive and less commonly used than X-rays, they can be invaluable in complex cases or when other tests are inconclusive. Ultrasound is another imaging technique that can help evaluate osteoarthritis. It uses sound waves to create images of soft tissues and can detect inflammation, fluid buildup, and changes in cartilage. Ultrasound is non-invasive and can be performed in real time, making it useful for guiding joint injections or assessing joint inflammation during a clinic visit. Computed tomography, or CT scans, are less commonly used for osteoarthritis but can provide detailed images of bone structure. CT scans are sometimes used when more information is needed about the extent of bone damage or when planning for surgery. They offer a three-dimensional view which can be helpful in complex cases. In addition to imaging, laboratory tests can help rule out other causes of joint pain and inflammation. While there's no specific blood test for osteoarthritis, certain lab tests are used to exclude conditions like rheumatoid arthritis or infections. Let's explore the main laboratory tests involved in osteoarthritis evaluation. Blood tests are not used to diagnose osteoarthritis directly, but they are important for ruling out other types of arthritis. Doctors may check for markers of inflammation, such as erythrocyte sedimentation rate, ESR, or C-reactive protein, CRP, and test for rheumatoid factor or anti-CCP antibodies. Normal results can help confirm that osteoarthritis, rather than an inflammatory arthritis, is the cause of symptoms. Joint fluid analysis, also called arthrocentesis, involves removing a small sample of fluid from the affected joint. This test helps rule out infections, gout, or other inflammatory conditions. The fluid is examined for crystals, white blood cells, and bacteria. In osteoarthritis, the fluid is usually clear and contains few white blood cells, helping distinguish it from other joint diseases. Erythrocyte sedimentation rate, or ESR, is a blood test that measures inflammation in the body. While ESR is usually normal in osteoarthritis, it can be elevated in inflammatory conditions like rheumatoid arthritis. This test helps doctors differentiate between osteoarthritis and other types of arthritis that cause more inflammation. C-reactive protein, or CRP, is another marker of inflammation measured in the blood. Like ESR, CRP levels are typically normal in osteoarthritis but may be elevated in other inflammatory joint diseases. Checking CRP helps doctors rule out conditions that cause more severe inflammation, ensuring an accurate diagnosis. Rheumatoid factor test checks for antibodies that are often present in people with rheumatoid arthritis. A negative result supports the diagnosis of osteoarthritis, while a positive result may indicate another type of arthritis. This test is part of the process of ruling out other causes of joint pain. Anticyclic citrullinated peptide anti-CCP antibody test is another blood test used to help diagnose rheumatoid arthritis. Like the rheumatoid factor test, a negative result supports osteoarthritis, while a positive result suggests another type of arthritis. These tests help doctors narrow down the diagnosis. Synovial fluid analysis is a laboratory test that examines the fluid inside your joints. In osteoarthritis, this fluid is usually clear and has a low white blood cell count. The test helps rule out infections, gout, and other inflammatory conditions. It's a valuable tool for confirming the diagnosis when symptoms are unclear. Genetic testing is not routinely used for osteoarthritis diagnosis, but research is ongoing to identify genetic markers that may increase risk. In rare cases, genetic testing might be considered if there's a strong family history of early-onset osteoarthritis. For most patients, however, diagnosis relies on clinical and imaging findings. Functional assessment evaluates how osteoarthritis affects your ability to perform daily activities. Doctors may use questionnaires or ask about your ability to walk, climb stairs, or carry out household tasks. These assessments help track disease progression and guide treatment decisions, ensuring that care is tailored to your needs. Pain assessment scales such as the Visual Analog Scale (VAS) or the Numeric Rating Scale (NRS) are used to measure the intensity of joint pain. Patients rate their pain on a scale, helping doctors understand how osteoarthritis affects their quality of life. These scales are simple but effective tools for monitoring symptoms over time. Western Ontario and McMaster University's Osteoarthritis Index, or WMAC, is a widely used questionnaire that assesses pain, stiffness, and physical function in people with osteoarthritis. It helps doctors evaluate the severity of symptoms and monitor changes over time, making it a valuable tool in both clinical practice and research. The Lequesny Index is another questionnaire used to assess the severity of osteoarthritis, particularly in the hip and knee. It covers pain, maximum distance walked, and activities of daily living. This index helps doctors track disease progression and evaluate the effectiveness of treatments. Physical performance tests such as the Timed Up and Go Tug test or the 6-minute walk test measure mobility and endurance. These tests involve simple activities like standing up from a chair, walking a short distance, or climbing stairs. Results provide objective data on how osteoarthritis affects movement and can help guide rehabilitation. Gait analysis examines how you walk and identifies changes in movement caused by osteoarthritis. This test can be done visually by a doctor or with specialized equipment that measures stride length, speed, and joint angles. Gait analysis helps pinpoint functional limitations and tailor physical therapy programs. Range of motion testing measures how far you can move your joints in different directions. Doctors use tools like goniometers to assess flexibility and detect stiffness or contractures. Limited range of motion is a common sign of osteoarthritis and helps determine the severity of joint involvement. Strength testing evaluates the muscles around affected joints. Weakness in these muscles can worsen joint instability and pain. Doctors may ask you to push, pull, or lift against resistance to assess muscle strength. This information is important for designing exercise programs that support joint health. Balance assessment tests your ability to maintain stability while standing or moving. Poor balance increases the risk of falls, especially in people with osteoarthritis of the lower limbs. Doctors may use simple standing tests or more advanced equipment to measure balance and recommend appropriate interventions. Functional reach test measures how far you can reach forward without losing balance. It's a simple way to assess stability and predict fall risk in people with osteoarthritis. This test is quick to perform and provides valuable information for designing safe exercise and rehabilitation programs. The stair climb test evaluates your ability to go up and down stairs, which is often challenging for people with osteoarthritis. The test measures time, number of steps, and any difficulties encountered. Results help doctors assess functional limitations and monitor improvement with treatment. The sit-to-stand test measures lower limb strength and functional mobility. Patients are asked to stand up from a seated position multiple times, and the time taken is recorded. This test is useful for evaluating leg strength, balance, and endurance in people with osteoarthritis. For osteoarthritis affecting the hands, doctors may use grip strength tests or dexterity assessments. These tests measure how well you can grasp, pinch, or manipulate objects. Results help identify functional limitations and guide occupational therapy interventions. Patient-reported outcome measures (PROMs) are questionnaires that capture your perspective on symptoms, function, and quality of life. These tools help doctors understand the impact of osteoarthritis from the patient's viewpoint and tailor treatment accordingly. Activity monitoring uses wearable devices or activity logs to track movement and physical activity levels. This information helps doctors assess how osteoarthritis affects daily life and can guide recommendations for exercise or physical therapy. Quality of life assessments use standardized questionnaires to evaluate how osteoarthritis impacts overall well-being. These assessments cover physical, emotional, and social aspects of health, helping doctors understand the broader effects of the disease and plan holistic care. Radiographic grading systems, such as the Kellgren-Lawrence scale, are used to classify the severity of osteoarthritis based on X-ray findings. These systems help standardize diagnosis and track disease progression over time, providing a common language for doctors and researchers. Bone scintigraphy, or bone scan, is a nuclear imaging test that detects changes in bone metabolism. It's rarely used for routine osteoarthritis diagnosis but may be helpful in complex cases or when other conditions are suspected. The test involves injecting a small amount of radioactive material and scanning the body for areas of increased activity. Arthroscopy is a minimally invasive surgical procedure that allows doctors to look inside a joint using a small camera. While not commonly used for diagnosis, it can help confirm osteoarthritis in unclear cases and guide treatment decisions. Arthroscopy is more often used for treatment than for initial evaluation. Researchers are studying biomarkers, molecules found in blood, urine, or joint fluid that may help diagnose osteoarthritis or predict its progression. While not yet used in routine practice, biomarker tests could one day provide earlier and more precise diagnosis, leading to better outcomes for patients. In some cases, doctors may refer patients to a rheumatologist or orthopedic specialist for further evaluation. Specialists have advanced training in joint diseases and can perform more detailed assessments or recommend advanced tests. Referral ensures that patients receive comprehensive care, especially in complex or severe cases. Osteoarthritis is a progressive disease, so ongoing monitoring is important. Doctors may repeat imaging tests, physical assessments, or questionnaires over time to track changes in symptoms and joint structure. Regular monitoring helps adjust treatment plans and maintain the best possible quality of life. Active patient involvement is key to successful osteoarthritis management. Patients are encouraged to report new symptoms, track their progress, and participate in decision-making about their care. This collaborative approach ensures that treatment is tailored to individual needs and preferences. New technologies, such as artificial intelligence and advanced imaging, are being developed to improve osteoarthritis diagnosis and monitoring. These innovations may offer more accurate assessments, earlier detection, and personalized treatment recommendations in the future. Sum up, evaluating osteoarthritis involves a combination of clinical examination, imaging, laboratory tests, and functional assessments. Each test provides unique information that helps doctors diagnose the condition, rule out other diseases, and develop effective treatment plans. Understanding these tests empowers patients to take an active role in their care. As research advances, new tests and technologies will continue to improve the evaluation and management of osteoarthritis. Staying informed about these developments can help patients and healthcare providers work together for the best possible outcomes. Thank you for joining us on this comprehensive overview of osteoarthritis evaluation methods.